10 silent warning signs of diabetes at night you can't ignore. Do you often wake up in the middle of the night drenched in sweat, suffering from painful leg cramps, or feeling an uncontrollable thirst? These seemingly normal signs could be early warnings of diabetes, a silent disease that can gradually destroy your body if not properly managed. According to research published in the Journal of Clinical Endocrinology and Metabolism, blood sugar levels below 70 milligrams per deciliter can trigger the autonomic nervous system, leading to excessive sweating at night. Another study from the American Diabetes Association (ADA) found that 54% of type 1 diabetes patients experience nighttime hypoglycemia at least once a week, often accompanied by sweating, nightmares, and restlessness. The frightening truth is that many people don't recognize these warning signals until the disease has progressed to a dangerous stage. Are you sure you're managing your health properly? Do you know how to prevent the serious complications that diabetes can cause while you sleep? In this video, we will uncover 10 alarming nighttime symptoms that could indicate diabetes. Don't miss out, because just one of these signs could be the key to protecting your health and preventing severe consequences. 1. Night sweats, a silent warning. Have you ever woken up drenched in sweat without knowing why? This could be a warning sign of low blood sugar, hypoglycemia. When blood sugar levels drop, the body responds by releasing adrenaline, which increases heart rate and activates the sweat glands. Research from the Journal of Clinical Endocrinology and Metabolism indicates that blood sugar levels below 70 milligrams per deciliter can trigger the autonomic nervous system, leading to excessive sweating. The American Diabetes Association (ADA) also warns that nighttime hypoglycemia is more common in individuals with diabetes who take insulin or sulfonylureas. A 2016 study published in Diabetes Care found that 54% of patients with type 1 diabetes experienced nighttime hypoglycemia at least once a week, often accompanied by sweating, nightmares, and restlessness. Are you experiencing these symptoms without knowing the cause? To manage this condition, monitor your blood sugar levels before bed and ensure they stay within the optimal range of 90 to 130 mg/dl. A balanced bedtime snack combining complex carbohydrates and protein, such as whole grain toast with peanut butter, can help stabilize glucose levels. Additionally, maintaining a room temperature between 18 to 21 degrees Celsius, 64 to 70 degrees Fahrenheit, can help prevent body temperature fluctuations that may trigger excessive sweating. If the symptoms persist, consulting a doctor for an HbA1c test to assess long-term blood sugar control and nerve function tests to rule out autonomic neuropathy is advisable. 2. Leg cramps, sharp disruptions in sleep. Have you ever been jolted awake by a sudden, painful cramp in your legs? If this happens frequently, it could be a warning sign of diabetes-related complications, such as electrolyte imbalances, nerve damage, or poor circulation. When blood flow and nerve function are compromised, the risk of nocturnal leg cramps increases significantly. Research from the Journal of Diabetes and its Complications has found that diabetes can impair both nerve signaling and circulation, making nighttime leg cramps more likely. Additionally, studies from the Mayo Clinic highlight that individuals with diabetes often have deficiencies in essential minerals like potassium, magnesium, and calcium, key elements required for proper muscle relaxation and function. Do you often experience leg cramps but aren't sure why? Addressing potential mineral deficiencies is crucial. A diet rich in potassium-containing foods such as bananas, sweet potatoes, and avocados, along with magnesium-rich sources like leafy greens and nuts, can improve muscle function and reduce the likelihood of cramping. Staying hydrated throughout the day is also essential, as dehydration can worsen muscle spasms. What steps can you take tonight to prevent leg cramps? Simple habits such as stretching before bed, particularly calf exercises, can enhance circulation and prevent cramping. Regular physical activity, especially low-impact exercises like swimming or walking, helps maintain proper blood flow and prevents muscle stiffness. Wearing well-supported footwear with proper arch support can also reduce strain on leg muscles, lowering the risk of cramping episodes. Fluctuating blood sugar levels can further contribute to nerve damage and circulation issues, making blood sugar monitoring an essential step in preventing diabetes-related cramps. If cramps persist despite lifestyle changes, consulting a doctor to assess nerve health and vascular function is advisable. In severe or frequent cases, Medical evaluations can help determine if conditions like peripheral neuropathy, abnormal nerve signaling linked to diabetes, are triggering these nighttime disruptions. Managing blood sugar effectively, maintaining circulatory health, and ensuring proper nutrition are all key to preventing leg cramps and improving overall well-being. Have you noticed a pattern in your leg cramps? What strategies have worked for you? Share your experience. 3. Restless Leg Syndrome, RLS, the uncontrollable urge. Do you ever feel an uncontrollable urge to move your legs at night, making it impossible to fall asleep? This could be Restless Leg Syndrome, RLS, a condition that disrupts sleep and is significantly more common in individuals with diabetes. Research from the National Institute of Neurological Disorders and Stroke shows that RLS often stems from peripheral neuropathy, where nerve damage leads to abnormal sensations, muscle twitching, and discomfort. A 2021 review in Sleep Medicine Reviews found that up to 30% of people with type 2 diabetes experience RLS, compared to just 10% in the general population. Scientists believe that dopamine imbalances, a result of metabolic dysfunction, play a key role in triggering these symptoms. Have you ever noticed your legs feeling restless at night? Simple lifestyle changes can help manage the symptoms. Light exercise, such as stretching or gentle movement before bed, can relieve nerve tension and improve circulation. Increasing iron and magnesium intake is also beneficial, as deficiencies in these minerals have been linked to RLS. Including foods like leafy greens, nuts, and whole grains in your diet helps support nerve function and maintain proper mineral levels. What habits could be making your RLS worse? Avoiding stimulants like caffeine, nicotine, and alcohol in the evening is essential, as these substances can worsen symptoms and further disrupt sleep. Managing underlying metabolic issues and maintaining stable blood sugar levels also play a significant role in controlling RLS symptoms for those with diabetes. If the discomfort persists, a visit to a neurologist may be necessary. Specialists can assess the severity of RLS and recommend dopamine-modulating treatments or personalized lifestyle adjustments to improve sleep quality and overall well-being. Have you found any effective ways to manage restless legs at night? Share your experience. 4. Sleep apnea, interrupted breathing at night. Do you or someone you know struggle with loud snoring, waking up gasping for air, or feeling exhausted despite a full night's sleep? These could be warning signs of sleep apnea, a serious sleep disorder where breathing repeatedly stops and starts during the night. People with diabetes face a higher risk due to excess weight, insulin resistance, and autonomic nervous system dysfunction. Research from the American Journal of Respiratory and Critical Care Medicine suggests that individuals with diabetes are significantly more likely to develop obstructive sleep apnea, OSA, which can worsen blood sugar control and increase cardiovascular risk. A 2020 study in Diabetes and Metabolism found that 86% of patients with type 2 diabetes and obesity had undiagnosed sleep apnea. Frequent oxygen deprivation during sleep can increase insulin resistance and inflammation, worsening diabetes complications. Have you ever noticed signs of sleep apnea in yourself or a loved one? Many cases remain undiagnosed because symptoms are often overlooked. Key warning signs include loud snoring, gasping for air during sleep, and frequent morning headaches. Daytime fatigue, difficulty concentrating, and waking up multiple times during the night are also strong indicators. In some cases, people may experience dry mouth, irritability, or even depression, further reducing their quality of life. Recognizing these signs early and seeking medical evaluation is crucial for preventing serious complications. What can you do today to reduce your risk? Losing excess weight is one of the most effective ways to improve sleep apnea. Studies show that even modest weight loss can enhance airway function and reduce breathing interruptions. Avoiding alcohol and sedatives before bedtime is also key, as these substances relax throat muscles, increasing the likelihood of airway blockage. If you frequently sleep on your back, try positional therapy. Sleeping on your side can sometimes alleviate symptoms and improve airflow. For moderate to severe cases, CPAP, continuous positive airway pressure therapy, is the most effective treatment. A CPAP machine delivers a steady stream of air through a mask, keeping airways open and ensuring uninterrupted breathing throughout the night. Many people report improved sleep quality, reduced daytime drowsiness, and even better blood sugar control after consistent CPAP use. For those who struggle with CPAP, alternative options like mandibular advancement devices may provide relief, by repositioning the jaw to maintain an open airway. If you suspect you have sleep apnea, consulting a sleep specialist is essential. A sleep study can confirm the diagnosis and help determine the best treatment plan. Addressing sleep apnea early reduces the risk of high blood pressure, heart disease, and worsening insulin resistance, improving overall health and diabetes management. Given the strong connection between diabetes and sleep apnea, healthcare providers should prioritize screening for high-risk individuals to ensure early intervention and better long-term outcomes. Have you ever experienced sleep apnea symptoms? What steps have helped you improve your sleep quality? Share your thoughts. 5. Frequent nighttime urination, nocturia, the endless bathroom trips. Do you find yourself waking up multiple times at night just to use the bathroom? If this happens frequently, it might be a warning sign of poorly managed diabetes. When blood sugar levels are too high, the kidneys work overtime to filter and remove excess glucose, leading to increased urination. According to the National Kidney Foundation, diabetes is the leading cause of kidney disease, which can impair the kidney's ability to concentrate urine, making nocturia even worse. A study published in Diabetes Research and Clinical Practice found that nocturia is significantly more common in individuals with uncontrolled diabetes. Research from the American Urological Association further confirms that frequent urination at night is linked to elevated glucose levels, as the kidneys attempt to flush out excess sugar through urine. Have you ever wondered how to stop these endless bathroom trips at night? The most effective solution is controlling blood sugar levels, as maintaining glucose within the recommended range helps minimize kidney strain and excessive urine production. Additionally, managing fluid intake plays a crucial role. While proper hydration throughout the day is essential, reducing water consumption 2 to 3 hours before bedtime can help prevent frequent nighttime awakenings. Avoiding caffeine and alcohol in the evening is also beneficial, as both act as diuretics that increase urine production and worsen nocturia. But what if the problem persists? Diabetes-related kidney damage, diabetic nephropathy, could be the underlying cause. When the kidneys lose their ability to regulate fluid balance, nighttime urination becomes more frequent. If you continue experiencing nocturia despite lifestyle adjustments, it's crucial to evaluate kidney function. Consulting a nephrologist for kidney function tests, such as an estimated glomerular filtration rate, eGFR, and urine albumin tests, can help detect early signs of complications. Addressing kidney issues early can prevent further deterioration and improve overall diabetes management. By keeping blood sugar levels stable, maintaining smart hydration habits, and identifying potential kidney concerns, you can take control of nocturia and enjoy better sleep quality and overall well-being. Have you ever struggled with frequent nighttime urination? What strategies have worked for you? Share your thoughts. 6. Excessive thirst, a persistent urge. Excessive thirst, especially at night, can be an early warning sign of high blood sugar levels. When blood glucose rises, the body attempts to eliminate the excess sugar through urine, leading to dehydration and an unquenchable thirst. According to a study published in Diabetes, Obesity and Metabolism, excessive thirst, or polydipsia, is one of the earliest indicators of diabetes, often appearing alongside frequent urination, known as polyuria. The American Diabetes Association states that prolonged hyperglycemia forces the kidneys to filter more glucose, increasing urine output and causing significant fluid loss, which exacerbates thirst. Research in the Journal of Clinical Investigation found that persistent dehydration from elevated blood sugar levels can lead to more severe complications, such as kidney dysfunction and electrolyte imbalances. This cycle of dehydration and excessive thirst can further impair metabolic function, making diabetes management more challenging. Addressing this issue requires a proactive approach that includes proper hydration, blood sugar control, and dietary adjustments. Drinking water consistently throughout the day rather than consuming large amounts at once helps maintain hydration and prevents sudden fluid imbalances. Monitoring blood sugar levels regularly ensures that glucose remains within the recommended range, reducing the strain on the kidneys and decreasing excessive thirst. Adjusting dietary habits by minimizing the intake of high sugar and high carbohydrate foods can help stabilize blood sugar and prevent spikes that contribute to increased thirst and dehydration. If excessive thirst persists despite these interventions, seeking medical evaluation is crucial. Persistent polydipsia may indicate underlying complications such as kidney dysfunction, electrolyte imbalances, or poorly managed diabetes. Consulting a doctor can help assess kidney function, evaluate diabetes management strategies, and identify potential medical interventions to address the root cause of excessive thirst. By implementing proper hydration techniques, maintaining stable blood sugar levels, and making necessary dietary adjustments, individuals with diabetes can effectively manage excessive thirst and reduce its impact on their overall health. 7. Peripheral neuropathy, numbness and pain in the legs. A tingling, burning sensation or complete numbness in the legs and feet at night could indicate peripheral neuropathy, a common complication of diabetes. Prolonged high blood sugar damages nerves, leading to abnormal signals or loss of sensation. The American Academy of Neurology states that nearly 50% of individuals with diabetes develop some form of neuropathy. High blood sugar levels damage small blood vessels that supply oxygen to nerves, leading to dysfunction and impaired nerve communication. A study published in Diabetes Care found that diabetic peripheral neuropathy is associated with an increased risk of foot ulcers and amputations due to the loss of pain sensation and delayed wound healing. When nerves are damaged, the body loses its ability to detect injuries, making even minor cuts or blisters a serious concern for infection and long-term complications. To improve blood circulation and support nerve health, engaging in light exercises such as walking and yoga can help promote blood flow to the extremities. Regularly inspecting the feet for cuts, blisters, or infections is essential, as reduced sensation may prevent individuals from noticing injuries before they become serious. Wearing well-fitted, cushioned shoes helps protect against foot injuries by reducing pressure points and preventing friction. Managing blood sugar levels is crucial in slowing the progression of nerve damage. Keeping glucose within a stable range helps preserve nerve function and reduces the risk of further complications. If symptoms persist or worsen, consulting a neurologist may be necessary. A nerve conduction study can assess the severity of neuropathy and determine the most appropriate treatment options. Addressing peripheral neuropathy early through lifestyle modifications and medical interventions can improve quality of life and prevent severe complications. 8. Nighttime hypoglycemia, the silent intruder. Low blood sugar or hypoglycemia at night can be particularly dangerous, as it may go unnoticed while sleeping. Symptoms such as excessive sweating, heart palpitations, trembling, and sudden awakenings may indicate that blood sugar levels have dropped too low. According to research in the Journal of Clinical Endocrinology and Metabolism, nighttime hypoglycemia occurs frequently in people with diabetes who take insulin or sulfonylureas, as these medications can cause glucose levels to dip excessively during sleep. A 2019 study in Diabetes Care found that up to 50% of insulin-dependent patients experience nocturnal hypoglycemia at least once per month, with some cases leading to confusion, seizures, or unconsciousness if left untreated. Since the body's normal counter-regulatory response to hypoglycemia is reduced during sleep, the risk of prolonged low blood sugar is significantly higher, making it essential for individuals with diabetes to take preventive measures. Monitoring blood sugar before bed is one of the most effective strategies to prevent nocturnal hypoglycemia. Ensuring glucose levels remain within the safe range of 90 to 130 mg/dl before sleeping can help minimize the risk of a sudden drop. Eating a balanced snack containing complex carbohydrates and protein, such as a small handful of nuts or whole grain crackers with cheese, can help maintain stable glucose levels overnight by slowing the absorption of sugar into the bloodstream. For those who frequently experience nighttime hypoglycemia, adjusting insulin or medication dosages under medical supervision may be necessary to prevent excessive glucose dips. Using a continuous glucose monitor, CGM, can provide real-time alerts if blood sugar levels drop to dangerous levels during sleep, allowing individuals or caregivers to take immediate action. Keeping fast-acting carbohydrates nearby, such as glucose tablets, fruit juice, or honey, ensures a quick response if symptoms of hypoglycemia occur. Proper diabetes management, including careful medication adjustments and nighttime glucose monitoring, is essential in preventing the severe consequences of nocturnal hypoglycemia and maintaining overall health and safety. 9. Insomnia, the battle against sleep. Difficulty falling asleep or staying asleep may be a sign of poorly managed diabetes. Blood sugar fluctuations, nerve pain, or elevated stress hormones can all contribute to disrupted sleep patterns, leading to chronic fatigue. A study in the Journal of Sleep Research found that individuals with diabetes are twice as likely to suffer from insomnia compared to those without the condition. Poor glycemic control leads to nighttime awakenings due to symptoms such as excessive thirst, frequent urination, and nerve discomfort, making it difficult to achieve restful sleep. A 2021 study published in Diabetes and Metabolism revealed that chronic sleep deprivation increases cortisol levels, which can further impair insulin sensitivity. This creates a vicious cycle where poor sleep worsens diabetes control, leading to further sleep disturbances. The disruption of the circadian rhythm due to unstable glucose levels can exacerbate insomnia, making it essential to address both sleep hygiene and blood sugar management. Maintaining a regular sleep schedule by going to bed and waking up at the same time daily helps regulate the body's internal clock. Monitoring blood sugar before bed ensures that glucose levels remain stable, reducing the risk of sleep disturbances caused by hypoglycemia or hyperglycemia. Engaging in relaxation techniques such as meditation, reading, or deep breathing can lower cortisol levels and promote better sleep quality. Avoiding blue light exposure from electronic devices at least an hour before bed is crucial, as blue light suppresses melatonin production, which can delay sleep onset. If insomnia persists despite lifestyle modifications, consulting a sleep specialist may be necessary. Conditions such as sleep apnea or restless leg syndrome, which are more common in individuals with diabetes, could be contributing to sleep disturbances. A comprehensive sleep evaluation can help identify underlying causes and guide appropriate interventions, ultimately improving both sleep quality and diabetes management. 10. Acid reflux, GERD, the burning sensation at night. Frequent heartburn, chest discomfort, or a sour taste in the mouth at night may indicate acid reflux, also known as gastroesophageal reflux disease, GERD. People with diabetes are at a higher risk of developing GERD due to nerve damage affecting stomach function, leading to delayed digestion and increased acid buildup. According to the American Journal of Gastroenterology, individuals with diabetes, particularly those with diabetic neuropathy, have a higher prevalence of GERD due to impaired stomach emptying, gastroparesis. This condition increases stomach pressure, causing acid to flow back into the esophagus. A study published in Diabetes Care found that up to 40% of people with type 2 diabetes suffer from GERD symptoms, significantly affecting their sleep quality and overall well-being. The delayed gastric emptying associated with diabetes can worsen acid reflux symptoms, making nighttime discomfort more common. To alleviate GERD symptoms, adjusting eating habits is crucial. Avoiding large meals before bedtime and opting for smaller, lighter meals throughout the day can prevent excessive stomach pressure. Identifying trigger foods such as spicy dishes, caffeine, alcohol, and fatty meals may help reduce acid reflux episodes. Maintaining a healthy weight is also important, as excess weight, particularly around the abdomen, increases pressure on the stomach and worsens GERD symptoms. Sleeping with the head elevated by about 15 to 20 centimeters, 6 to 8 inches, can help prevent stomach acid from traveling back into the esophagus, reducing nighttime reflux episodes. If symptoms persist despite lifestyle changes, consulting a doctor is recommended. Medications such as proton pump inhibitors, PPIs, or H2 blockers may be prescribed to reduce stomach acid production and improve digestion. Additionally, managing stress through relaxation techniques like meditation or breathing exercises can help prevent GERD flare-ups. By keeping blood sugar levels stable, making dietary adjustments, and seeking medical guidance when necessary, individuals with diabetes can effectively control GERD symptoms and improve their overall quality of life. We've just uncovered 10 silent warning signs of diabetes at night, subtle signals your body may be sending while you sleep. From night sweats and restless legs to frequent urination and sleep apnea, these symptoms could indicate blood sugar imbalances that need attention. Catching them early can help prevent serious complications and improve your overall health. If you've noticed any of these signs, don't ignore them. Monitor your blood sugar, make healthy lifestyle changes, and consult a doctor if needed. Small steps today can make a big difference. Have you experienced any of these symptoms? Share your thoughts in the comments. Like, share, and subscribe for more health insights. Stay informed, stay healthy, and I'll see you in the next video.